Good afternoon, honorable members. Honorable members, in the business of this House suspended, the honorable member for Bamboo Town had reserved the floor. The chair recognizes the honorable member for Bamboo Town.
Thank you, Mr. Speaker. Mr. Speaker, I rise in this honorable house today in usual fashion with thankfulness in my heart, praising Hashem, the Elohim of the Elohim, who has blessed us in heavenly places with all spiritual blessings. He is the Lord of life, the source of all hope, faith, and love. And may his name forever and forever it will be praised. Mr. Speaker. Mr. Speaker, he has filled us with faith and hope. And it's through the eyes of faith and hope, coupled with firm action, I can see the evidence of this COVID-19 pandemic ending. For we know that faith without works is dead. I continually put my complete trust, hope, and confidence in Almighty God, Yahweh Elohim, to see us through these challenging and ever-changing times. Mr. Speaker, it is the fuel of love that drives me more than anything. I am filled and buoyed with love for my God and love for my fellow man, such that I can get up every day to stand steadfast at the job, to seek to ensure the optimal level of health and well-being of all persons in the Bahamas. For indeed, he has commanded me to not grow weary in doing well, for in due season I will reap a reward, Mr. Speaker, if I faint not. And Mr. Speaker, as we deal with matters of the spirit, I take this opportunity to send my condolences to the family of Stephanie Wells, to Cleveland, Baby Ann, and Tennyson Wells Jr. on the loss of their dear mother. I offer condolences to the family of Bishop Benjamin Wenner Davis, to the family of Sir Charles Carter, to the family of Senator Delayed Aubrey Hanna, and the family of Donald Simonette, my dear friend, who I ate breakfast with every Saturday morning before the COVID pandemic. He was an excellent friend, a great mentor, and a great political advisor, Mr. Speaker. He will be sorely missed by me. Mr. Speaker, I also rise on behalf of the good people of Bamboo Town who have sent me to this place for a second stint to serve in their interests, to give values to their voice, and to be the voice of their values. Mr. Speaker, Lord willing, and I know he's willing, I will be here on that great getting up morning when the F&M Saints shall rise after the next general elections. For the word declares that the heart of the king is in the hand of God, and as the rivers of waters, he turneth whithersoever which way he wills, Mr. Speaker. We know that in a democracy, the people are king, but it is the word, the Lord of providence, who determines the outcome. So, Mr. Speaker, I am thankful to the good Lord, and I'm very thankful to my constituents who have stood by me through thick and thin and showed their unwavering confidence in my ability to represent them in this honorable place. Mr. Speaker, it remains my honor and esteemed privilege to be their representative. I have an everlasting love for them and assure them that their confidence will never be misplaced in this member. Mr. Speaker, over the past 4 years since this administration was elected to office, we have been busy about the Bahamian people's business. Busy about building a more resilient and economically prosperous society. Mr. Speaker, we have been busy with the Bahamian people's business in the area of food security and food sovereignty. As the Minister of Agriculture and Marine Resource, the Honorable Michael Pintard, advised, we are reducing our dependency on imports and increasing food security in this country. Mr. Speaker, we've been busy with the Bahamian people's business in energy security. In the summer of 2019, the Deputy Prime Minister, the Honorable Desmond Bannister, ensured that there was more than enough generating capacity on the island of New Providence with the installation of new electrical generating engines. These new engines at Clifton replaced the old end-of-life generators that were installed in the 1960s by the then UBP government, Mr. Speaker. Mr. Speaker, we did not know that COVID-19 was coming to our shores at the time. However, adequate electricity generation came right on time so that persons could remain comfortable at home during the COVID-19 pandemic lockdowns and emergency orders. Foresight, Mr. Speaker. Mr. Speaker, we are also expanding the penetration of renewable energy in the country. Currently, solar power is being installed in Ragged Island. We are also working aggressively to secure LNG to power energy in the country, and perhaps to secure bunkering to service the cruise ships as we fully establish and expand our home porting here in the Bahamas. Mr. Speaker, we've been busy with the Bahamian people's business by protecting our heritage and our environment. This administration has prohibited cruise ships from dumping treated or non-treated sewage water, waste oil, and garbage in our territorial Bahamian waters. Mr. Speaker, this administration has been busy with the Bahamian people's business. Scientists are now required to register to conduct research in the Bahamas. This administration will continue to exercise its right to protect the genetic material scientists will have access to during their research in our waters. This administration has ensured that the Bahamas can authorize access, control the use, and establish fair, equitable sharing of the benefits of genetic scientific finds in the area of medicines and cosmetics on the land and sea. Mr. Speaker, we've been busy with the Bahamian people's business in education. The Honorable Jeffrey Lloyd reminded us that today families can send their little ones from preschool to elementary school, high school, straight to the University of the Bahamas to obtain a bachelor's degree free of charge. Mr. Speaker, Family Island students also receive $500 to assist with accommodations while attending UB. Mr. Speaker, BAMSI is free. BTVI and other vocational training is also free of charge, Mr. Speaker, in this Commonwealth of the Bahamas, delivered to you by this Free National Movement administration. Mr. Speaker, we've been busy with the Bahamian people's business and tourism. This administration has recorded the largest number of tourists visiting the Bahamas, some 7.2 million tourists in 2019. The year Hurricane Dorian slammed into this country, Mr. Speaker, we saw the greatest and experienced the greatest growth in tourism. Now, no doubt, with home porting, we are making the Bahamas an iconic world-class destination with potential touristic exponential growth. And so I believe, Mr. Speaker, we will outdo 2019 very, very shortly. Mr. Speaker, we have been busy with the Bahamian people's business and transport. Bahamians, Mr. Speaker, can now turn left on the red light, which reduces stress, the time for morning and evening commutes, and the money spent on gas waiting at red lights. Mr. Speaker, we've been busy with the Bahamian people's business with respect to the post office. Yes, the post office. Mr. Speaker, you don't even hear about the post office anymore in other places. Gone are the days, Mr. Speaker, of protesting and workers only reporting for half days. For the first time since the 1970s, the General Post Office has passed the United Nations postal audit. You see, Mr. Speaker, the post office is considered a port of entry and has to comply with 9/11 regulations for ports of entry. During this process, the Bahamas also obtained its security certificate for the General Post Office for the first time. Mr. Speaker, we've been busy with the Bahamian people's business in economic empowerment. We have provided Bahamian businesses with over $100 million in grants and loans to small businesses. And many, many small businesses have stepped forward to avail themselves of this funding opportunity offered by this government. Mr. Speaker, we've been busy economically empowering the poor and middle class. The mom and pop stores in the over-the-hill communities with the establishment of the over-the-hill economic zone. Mr. Speaker, we've been busy with the Bahamian people's business to compensate the frontline nurses, physicians, and medical service workers involved in COVID-19 national response for the period the 19th of March through the 18th of June of last year. Mr. Speaker, this administration approved $1,040,600 in an honorarium and death benefit in this budget that will be paid out as follows. $400,000, Mr. Speaker, as a death benefit to the legal representative of the 4 healthcare workers that passed away in the line of duty for COVID-19. Mr. Speaker, that is going to be done here in this period before the end of June. And Mr. Speaker, I would like to just request at this point in time for the House, you could pause my time, if the Speaker agrees, that we would all stand and honor a moment of silence for the 4 individuals who passed away in the COVID fight, as well as the other healthcare individual who passed away in the private sector, and all of those who have been working so hard with COVID-19 in country. Thank you. Mr. Speaker, we will pay out some $640,600 to 143 frontline healthcare workers who stepped forward initially during the first wave of COVID-19, who came forward and said, "Here am I, send me," when others were somewhat tepid and hesitant. Mr. Speaker, for those who later joined the fight, this administration approved an additional $3 million in honorarium in this 2021-2022 budget that will be paid out to some 1,690 healthcare workers. Mr. Speaker, the government also paid overtime to nurses who worked during the COVID-19 pandemic. Mr. Speaker, this government approved $162,313 in overtime to nurses in the Ministry of Health during the period of January to August of last year, which was paid in October of last year. Mr. Speaker, I made a definitive decision in September of last year that overtime in the Ministry of Health was not to accrue, and that overtime was to be paid on a monthly basis. However, the Ministry of Health is still on a paper-based honor system. Even after some overtime monies were paid, log sheets were still being submitted for overtime spent during Hurricane Dorian. Although the government was ready to pay the overtime accrued by employees, the government still had to wait for the log sheets to be administratively compiled and presented with accurate cost. Mr. Speaker, I want it to be noted by all and sundry that the Public Hospital Authority does not have this problem in paying overtime to healthcare workers, since the Public Hospital Authority has an AccuStar sign-in electronic program system. Consequently, nurses employed at PMH were paid their overtime monthly and on time. Mr. Speaker, I want it to be known that the time to wait on log sheets has come and gone. The Ministry of Health will be investing in a biometric sign-in program for the Department of Public Health that will make overtime payments on time and more seamlessly done. Mr. Speaker, at this stage, let me address another matter brought up by the member for Golden Isles. Mr. Speaker, according to the World Health Organization, for all countries to reach the Sustainable Development Goal number 3 on health and well-being, it is estimated that the world will need an additional 9 million nurses and midwives by the year 2030. Currently, the University of the Bahamas recently graduated some 40 nurses with a Bachelor of Science degree in nursing. These same nurses are scheduled to sit the nursing council examination in November of this year. Another 30 nurses will be graduating by the end of this summer session, Mr. Speaker. That's 70. Behind this group next year is approximately another 100 nurses. So, Mr. Speaker, by the end of this upcoming fiscal year, there will be an additional 170 Bahamian nurses for our healthcare system. Mr. Speaker, the member for Golden Isles also asked where are we going to get the other allied healthcare workers. The answer, Mr. Speaker, is in our schools. We are creating in our tertiary institution the full suite of allied health professionals that will produce experts for subsequent years to come to fully staff our healthcare system. Golden Isles, we must look to our young people to help get our country through these difficult times and to help this nation's recovery. This pre-national movement government, Mr. Speaker, is doing just that with this program. Mr. Speaker, speaking about recovery is precisely what this budget is all about. It is the economic elixir for what ails our nation. The good book says that there's a time and a season for everything under heaven. A time for planting and a time for reaping. A time for austerity and a time for plenty. Mr. Speaker, now is not the time for austerity. This is a time for prosperity and plenty. That is what this budget signifies. In fact, this budget is so good that the member for Exuma has likened it to a fairy tale, an Alice in Wonderland story scenario. To him, it is too good to be true. But to us, it is factual, not fiction, not fairy tale. Not to mention that some of the measures undertaken in this budget was recommended by the good member last year as a way to buttress and shore up our economic life. And you know, Mr. Speaker, the member for Exuma should have stayed in that fairy tale land with the Bahamian people and the Free National Movement government. I fear that since he's left the story, he will not be there at the end of that happy ending on the general election day when the Free National Movement is elected as the government of the Commonwealth of the Bahamas. Mr. Speaker, to spur us on to recovery, the good member advised that we should borrow $2 billion. Well, Mr. Speaker, we are borrowing the $2 billion. We borrowed $1.3 billion last year as a part of the Resilient Bahamas plan, and we are borrowing another $900 million plus for our newly proposed accelerated Bahamas recovery plan. Did I say plan?
Yes, plan.
Yes, I said plan, Mr. Speaker.
Plan.
Just like we detailed and executed a plan for our nation in our response to COVID-19, we have detailed the nation's recovery and a plan to accelerate that recovery over this coming fiscal year. Indeed, Mr. Speaker, based on our track record, there is no doubt that we have come to the kingdom, Mr. Speaker, for such a time as this.
Bring it home, Bishop.
Mr. Speaker, I'm going to stop right there and get to the remit that the Prime Minister has given to me. And the good Lord has sought to lead me through.
Preach. Yeah.
Those who vaccinated?
Mr. Speaker, I take this opportunity to encourage my beloved Bahamians who are emerging from these difficult 20 months under the devastating damage of Hurricane Dorian and the scourge of COVID-19. Last year brought much challenges to the overall physical, mental, and economic health of our nation. But Hebrews 10:39, I can preach again, Mr. Speaker, gives us hope. Mr. Speaker, it says that as a nation, we do not belong to those who shrink back and are destroyed, but to those who have faith and are saved. Mr. Speaker, we will recover. The road to recovery is not an easy one. However, with the 7-pillar accelerated Bahamas recovery plan that was tabled by the most honorable Prime Minister, the Minister of Finance, we chart our steps to rapidly return to a sense of normalcy here in country. Mr. Speaker, my ministry looks forward to participating in the rollout of that plan. Healthcare improvements and vaccinations form the 3rd pillar. Accordingly, the Ministry of Health has been allocated $297,081,014 for the 2021-2022 fiscal year to support our actions. $223,455,825 for the Public Hospital Authority, $45 million for the National Health Insurance Authority, and $47,474,124 for the Department of Public Health. These appropriations will facilitate these four areas of our healthcare sector. First, substantial investment in healthcare infrastructure. Second, expansion of telemedicine to improve access to healthcare. Third, expansion of universal healthcare coverage via the national insurance. And fourth, the enhancement of supports to mitigate COVID-19, including vaccinations. Mr. Speaker, we are a government who's committed with our whole heart to the enhancement of our healthcare system, with the focus of saving lives and improving healthcare outcomes, putting more care into the word healthcare. Mr. Speaker, we realize that in order to further achieve our desired outcomes, we will have to greatly improve our healthcare infrastructure throughout the nation. We have taken the decision to renovate some structures and to build new ones. Consequently, renovations will be made to the priority wards and patient care environments to address bed shortages while ensuring compliance with COVID-19 spacing requirements and infection control practices. The attendant goal of these improvements aligns with the core values that all individuals and communities receive health services they need without suffering financial hardships. Mr. Speaker, our infrastructural plan incorporates as its basic consideration the provisions of par excellence service in environments that prioritize our clients, the Bahamian people's privacy, dignity, and confidentiality. We will incorporate the latest use of smart and green technology to provide for safe delivery of routine medical services. We will incorporate the proliferation of e-health services and telemedicine and the safe management of all infectious disease, including COVID-19. Mr. Speaker, buttressed by funding acquired from the World Bank, Multi-Investment Guarantee Agency, MEGA, and the Inter-American Development Bank, the government will transform the face of the healthcare sector to modernize